All right. Hi, everybody. Welcome to the Functional Solutions podcast. This is brought to you by the American Academy of Functional Health. My name is Dr. Chill. I am the business and medical educator here, along with my awesome co-host, Dr. Asia. Hi, Dr. Asia. How are you doing?
Hey, I'm good. I'm good. Thanks for having me today, and it's good to see you.
You too. This is the first time we're doing this
I
podcast
know.
together, right?
I know. I was so excited. Yeah.
I'm really excited. And we have actually a super interesting topic. And it's one of those things that often goes overlooked,
Yeah.
especially in reproductive health. So
hmm
I'm glad we're kind of going into some of these details today. We have a
Same.
lot to share for you out there. And welcome, everybody. So, really, for you guys, if you're looking to uncover the root causes of chronic diseases, you want to gain practical tools to help your patients thrive, you are in the right place and at the right time. Each week, we are going to be exploring actionable science-based strategies to really move functional medicine forward in the clinic and beyond. And today's episode is really no different. We're going to be diving into a fascinating connection between maternal gut health and pregnancy and diseases. So, whether you're supporting your patients through pregnancy or helping them prepare for pregnancy, it's really essential to understand how the microbiome imbalances can disrupt metabolic and immune deregulation or regulation. And this is all during pregnancy. It's these disruptions, they not only increase the risk for insulin resistance and blood sugar dysregulation, but they also contribute to a broader complication, such as hypertension, inflammation, and premature birth. These are all things that we're going to be discussing today. And in the United States, the rate of gestational diabetes, and we're going to get into that a little bit for you in this topic today, and hypertensive disorders of pregnancy, they're steadily rising. And this is going to be mirroring broader trends in metabolic dysfunction. And what we're seeing with the standard treatment approaches, they often focus on short-term management. It's really controlling blood sugar, blood pressure. This is all through medications, some dietary adjustments. These interventions are important, right? But what's happening is they may be overlooking a deeper root cause, such as chemical exposures, poor gut health, nutrient deficiencies, and chronic inflammation. All things that we talk about often in functional medicine. And really, from a functional medicine perspective, with maternal metabolic complications, these aren't simply viewed as isolated or inevitable events, but as the result of interconnected imbalances. And that's what we're really going to be diving into in this podcast for you. And it's really recognizing and addressing those environmental and microbial factors that are involved. That's when we start to move beyond symptom management and toward true prevention, resilience, and long-term health for both the mother and the baby. And this is what it's really all about with the functional medicine approach. So, Dr. Asia,
Yeah.
really, this topic can be really broad, but there's such a major topic that we need to discuss within reproductive health, especially in pregnancy, and that's really the microbiome, right? What
Yeah.
what are you seeing within the research with the microbiome and how it changes during pregnancy?
Yeah. I would say it's still a burgeoning area. I
Mhm.
think the microbiome in general is just, always going to be this like never ending because we all have different microbes, different microbiomes, and kind of different pathologies associated with that. So it's really interesting to see all this literature coming out about pregnancy, maternal health, and kind of how we can use the microbiome. So in general, when you look at kind of the general maternal gut changes during pregnancy, the maternal gut microbiome during pregnancy, the very beginning, it actually looks very similar as it does when a woman's not pregnant. So the first trimester microbiome looks really similar to a non-pregnant microbiome. So as pregnancy progresses, the microbiome starts to shift. And the research reveals that about 70% of women experience a rise in gut bacteria that are linked to inflammation. One of the most notable changes occurs is going to be the balance between two major groups of bacteria. The firmicutes, also called Firmicutes, and then also the Bacteroidetes families. So there's a tilt towards more Firmicutes during pregnancy, which is interesting because when you look at metabolic issues, you tend to see a tilt towards this Firmicutes family as well. So that's one thing we see. At the same time, inflammatory markers in the body, these cytokines, interleukin-6, your TNF alpha, and others, they begin to rise, not just in the bloodstream, but also in adipose fat tissue and the placenta and even the gut lining itself. So essentially during pregnancy, the body actually enters into a state of low-grade inflammation. Now, if these changes were happening outside of pregnancy in somebody who's not pregnant, it's going to raise red flags for practitioners. Hopefully, we'd be thinking about chronic diseases, metabolic issues, hypertension, blood sugar imbalances, things of that nature. But in pregnancy, it's really interesting because this seems to be a really natural, even necessary adaptation. So these changes are going to help the body store energy, support the baby's development, and also get things ready for breastfeeding later on. So we have this really cool image that kind of demonstrates some of these changes. It's an image from a 2023 journal, Antioxidants, and it's looking at the physiological changes in the maternal microbiome during pregnancy. So we see the gut, vaginal and oral microbiome. We're going to really focus on the gut. In the gut microbiome, we see, like we mentioned, at the beginning of pregnancy, the microbiota profile is similar to that of a non-pregnant woman. As the pregnancy progresses, there is an increased amount of bacteria. There's more beta diversity, an increase in the Proteobacteria, which is kind of a group of bacteria commonly associated with dysbiosis, increased Akkermansia, a reduction in alpha diversity, and butyrate producers. And as we go along, we'll talk a lot about the butyrate producers, specifically short-chain fatty acids, because they're really important in pregnancy. And so you see during pregnancy, one of the changes is that there is a reduction in the butyrate producer. So we also see changes in the oral microbiome and the vaginal microbiome. Maybe that'll be a topic for another time. But let's do a pop quiz to see, kind of test our knowledge. So at the beginning of pregnancy, how does a woman's gut microbiome compare to that of a non-pregnant woman? A, it is significantly more diverse. B, it closely resembles the non-pregnant state. C, it is dominated by pathogenic bacteria. Or D, it becomes immediately pro-inflammatory. Give you a few seconds to answer. So the correct answer is going to be B. It closely resembles the non-pregnant state. It's not until the second and third trimester where you start seeing those major shifts in the microbiome. Okay, so outside of this, if you're interested in learning more about optimizing your patient's microbiome for pregnancy and metabolic health in general, you can always log into your advanced and clinical functional medicine platform. You can also book a coaching call with us to review your case studies. And remember, this is a part of the program and it's of no extra cost to you. So that's just a general overview of microbiome changes during pregnancy. We're going to kind of jump into specific conditions within pregnancy and microbiome changes. So Dr. Chill.
Yeah, that was a great overview. Thank you for sharing that.
Totally.
A lot of people don't understand that there are some changes with the microbiome during pregnancy, and some of those changes are needed, right?
Yeah.
But it's when those changes become imbalanced at
Right.
some point, And this is what we're looking at. It's this imbalance that occurs that can cause some of these issues that we're going to be discussing today. So thank you for sharing that overview. It's really actually really insightful.
Totally.
And so now that we understand the overview, let's take a look at some of these imbalances that Dr. Asia was talking about and what we were kind of going into and how it relates to the risk of things like gestational diabetes, preeclampsia, preterm labor. And then we also want to discuss some of the ways to support the microbiome during pregnancy to kind of really optimize it for our patients. So let's first talk about the gut microbiome and the risk of gestational diabetes. What we're going to look at is the maternal microbiome. This might play a role in gestational diabetes. The research is still ongoing, but what we do see within the literature is some compelling connections. In gestational diabetes, and again, with gestational diabetes, this is defined as hyperglycemia diagnosed during pregnancy. There are certain risk factors that are increased and that will increase the risk of gestational diabetes. This includes reduced physical activity, ethnicity, hypertension, low HDL, and an elevated HbA1c. So some of the complications that we're seeing with gestational diabetes can also impact both the mother and the baby. Let's take a look at an image to just kind of dive into this a little bit further here. This is from the Journal of Microorganisms. We can see the specific microbial shifts that occurs in gestational diabetes here. What we're seeing in this image are the changes in the gut microbiome. This is more commonly known as leaky gut. If you've been listening to the podcast and you're in the Advanced in Functional Medicine program, you know that we focus heavily on the gut microbiome, the dysbiosis, intestinal permeability, what we're calling leaky gut. Within gestational diabetes, leaky gut can also impact what happens here as well. What we're seeing in this image are the bacterial byproducts. They're moving across the gut lining. This is going to trigger an immune system activation along with that nasty chronic inflammation that we often see with our patients. And it's this process that can interfere with how the body handles insulin, really making it harder to regulate blood sugar for these mothers. And some of the studies are finding that compared with the microbiome of a normal glycemic pregnant women with gestational diabetes, they've demonstrated a few of the following with their microbiome. They've had decreased levels of multiple beneficial bacteria. We know that with a healthy microbiome, the diversity is really important with that. And this includes species such as Bifidobacterium, Lactobacillus. These bacteria can help maintain healthy glucose metabolism. And then there are also increased levels of non-beneficial bacteria. This is where dysbiosis also occurs, right? That overgrowth that can happen, such as Klebsiella. And this can also contribute to gestational diabetes. This disrupts the gut microbiome, continues to promote systemic inflammation. It's that vicious cycle that we continue to see. And this can also impair insulin sensitivity, especially during pregnancy. And what's really interesting here are that some studies have shown that women with gestational diabetes can have dysbiotic microbiome up to 16 months postpartum. And so this is why it's really important to look at a patient's microbiome in reproductive health and help to look at balancing them and ensuring that there is a healthy microbiome for our patients in reproductive health. And that's going to bring us to another pop quiz here. What's a surprising finding about the gut microbiome of women with gestational diabetes postpartum? Is it A, it returns to normal immediately after delivery? Is it B, it becomes enriched with probiotics? Is it C, it may remain imbalanced for up to 16 months? Is it D, it becomes identical to women with gestational diabetes? I'm going to give you a couple of moments to answer, and feel free to post in the chat. And I just covered this. All right, if you answered C, it remains imbalanced for up to 16 months. You are correct. The answer is C. It can remain imbalanced for up to 16 months. And this is post-pregnancy, right? And so this is one of the reasons, again, why the microbiome is extremely important for pregnancy and general overall health. Now that we've talked about giving you an overview of some of the changes within the microbiota in pregnancy, we've talked about some of the risks that are associated with gestational diabetes. Dr. Asia is going to talk about, we're really diving into the gut microbiome and how the imbalances of the gut microbiome can increase the risk of preeclampsia.
Yeah, thanks for that deep dive on gestational diabetes. I always think of all of our patients or clients who already come to us, even just before thinking about pregnancy, with microbiome issues, which is a bulk of what we see, right? So you think about setting that tone a little earlier, but that was really interesting, especially the 16 months postpartum piece.
I know a lot of people don't get that, right?
Right.
And so it's important to have a healthy microbiome throughout the entire pregnancy.
That's right. That's right. Okay. So as it relates to the gut microbiome and the risk of preeclampsia, let's just talk about some of the microbial shifts that happen there. So preeclampsia is classically defined as a disorder of pregnancy associated with new onset hypertension, usually with accompanying proteinuria, so protein in the urine, spilling of protein, if you will, and it's a leading cause of maternal and perinatal mortality worldwide. So we're going to jump right into an image. Let's take a look at this illustration from Frontiers in Cellular and Infection Microbiology. It's demonstrating the potential mechanisms in which a dysbiotic microbiome can drive three of the main symptoms or issues in preeclampsia, or alternatively, how separately preeclampsia itself may trigger a dysbiotic gut microbiome, potentially mediated through the placenta, which is a huge focus in preeclampsia. Like I mentioned, much of the focus in preeclampsia is related to or centered around the placental health. Researchers have found that lower levels of short-chain fatty acids, like butyrate, which is one I feel like we've talked about before on the podcast, low short-chain fatty acids in the placenta of people with preeclampsia compared to those with normal pregnancies, you see lower amounts. And those lower amounts of short-chain fatty acids seem to be linked to higher blood pressure and protein in the urine, which are two hallmarks of preeclampsia. If you look at some of the animal studies, when these short-chain fatty acids are given to rats with preeclampsia alongside a beneficial microbe called Akkermansia, there were some pretty impressive results. The placenta actually grew in size and weight, and several key inflammatory markers dropped significantly. Not only that, but levels of a molecule that interfere with healthy blood vessel growth also decreased. It's a long word. We're not really going to mention it, but that actually also decreased as it relates to just short-chain fatty acids. So the short-chain fatty acids didn't just reduce inflammation, it also seemed that they supported better placental development. And I always tell people, like, when you think about short chain fatty acids, it's pretty much, they're a lot of the times made from fiber consumption. So the microbes in your gut will break apart the fiber you eat, or your patient eats, say a carrot, carrot fiber, and it produces these short chains of fatty acids that can improve your gut health, but also improve systemic health. So it's really impressive, these specific little molecules. So women with preeclampsia tend to have more LPS, lipopolysaccharides, circulating in their blood, which comes from your gut microbiome. And the bacteria responsible for producing it are more active in the microbiome. This could set off a cycle of inflammation, gut imbalance, and put more strain on the placenta and vascular system. So researchers have noticed that the same types of bacteria linked to preeclampsia are also tied to other health issues like obesity, weight imbalances, blood sugar problems, chronic inflammation, and leaky gut, intestinal hyperpermeability. So the microbes don't just hang out quietly, they actually are influencing the immune system as well. And specifically, they've been shown to affect markers like interleukin 6, which is a pro-inflammatory cell messenger, and LPS, which is a component found on the bacteria that can trigger immune responses. So we kind of talked about that bacteria earlier, the proteobacteria, which can generate LPS as well. So these findings may suggest that when the gut microbiome is imbalanced early in pregnancy, especially if the immune system is already a bit overactive, it could help set the stage for complications like preeclampsia to develop. And so I would say next we'll do a little pop quiz to see. There we go. Okay, so in people with preeclampsia, what key substance is found at lower levels in the placenta? Is it probiotics, bile acids, short chain fatty acids, and omega-3 fatty acids? We actually only talked about one of these things. So everybody should get this right. You can put your answer in the chat. And all righty. If you answered C, you are correct. Short chains of fatty acids. So it's really interesting what we're seeing in the microbiome and just shifting microbial health and how it can shift patient outcomes and just patient health, maternal health, fetal health. So I'll pass it back to Dr. Chill to talk about kind of the next little piece around maternal health and the microbiome.
Thank you for sharing that. Short chain fatty acids are everything, especially in metabolic health, right?
Yes.
You don't understand how often I see short chain fatty acids being decreased when I'm working with my weight management patients, right? Or I'm working with practitioners that are bringing in their case studies, and we run gut assessments on them. One of the main things is they are deficient in short chain fatty acids. And what do short chain fatty acids do? They feed our gut microbiome, right? They make them healthier. And of course, if you're deficient in it, you're not going to have a healthy microbiome. And this can cause that metabolic dysfunction that we're seeing, not only in general cardiovascular health and metabolic health, but we're seeing it in pregnancy and maternal gut health as well. So thank you for sharing that, because it's such a big component of microbiome health.
Agreed.
And so now let's talk about the other risk factor that can happen from imbalances of our gut microbiome, such as the risk of preterm labor and fetal growth restriction. Let's talk about preterm labor and preterm birth here. It's defined as delivery before 37 weeks of pregnancy. This is one of the primary contributors to newborn illness and death worldwide. Over 60% of preterm births are considered spontaneous, whereas the non-spontaneous preterm births are due to maternal health conditions. And this is such as preeclampsia that we discussed. Now, the literature for preterm labor, this is all still growing research, right? But what we're seeing here with the current research is that there are patterns that are beginning to emerge that we do have. And we want to go into a couple of these studies here. One in particular. It was a study done by Shiozaki and colleagues. This was done in 2014. They found that women who delivered preterm had noticeably different gut microbiomes compared to those with full-term pregnancies. Again, I'm going to restate that. The women who had preterm pregnancies, they had different gut microbiomes compared to those with full-term pregnancies. What they saw was that there were lower levels of Clostridium groups and bacteroids in the preterm labor group. Dr. Asia mentioned some of that bacteroids earlier with some of the changes, right? And some of the health effects with the bacteroids as well. And what other studies are revealing is that there are spontaneous preterm births. These have been linked to reduced gut microbiome diversity in pregnancy in women. Remember, we discussed that your microbiome has to have healthy diversity along with lower amounts of pathogenic, or what's considered the bad bacteria or bad microbes, right? It has to have both. And there is also an association between microbial diversity and then the reduction in risk of delivering early. Now, what we're drawing conclusions from here is that what this research is showing is that it's reinforcing the importance of the health of the gut microbiome while pregnant, and then how the microbiome may influence different aspects of pregnancy. Now let's take a look at an illustration from the 2022 Journal of Microbiology here. And this is really revealing different microbiome inputs that may contribute to preterm labor. This is going over the gut microbiome, the vaginal microbiome, and then the oral and placental microbiome. You can see that all on the top there. And what we're seeing here with the gut microbiome, right, is that if there is intestinal permeability, this can increase those inflammatory cytokines that Dr. Asia was mentioning here. This can also increase that LPS that Dr. Asia was talking about, and this can also influence preterm birth. So we'll really focus on that gut microbiome portion here and how that affects preterm birth, right? So you understand this, and you'll be able to educate this to your patients who you're working with for fertility or reproductive health on the importance of the gut microbiome and what can occur if there are imbalances, especially with that LPS, that inflammatory cytokines due to the intestinal permeability that can happen. Now let's go into another quiz here. We have a lot of quizzes for you today. With the study by Shiozaki and colleagues, what did they find about the gut microbiome of women who delivered preterm? Was it A, they had more probiotic bacteria than those who delivered at term? They had lower levels of Clostridium groups and bacteroids. Their gut microbiomes were identical to those who delivered at term, or they had increased fungal growth. And this is based on what was just discussed on this study. I'll give you a few moments here. All right, if you answered B, they had lower levels of Clostridium groups and bacteroids, right? This is really part of the diversity picture. This is really part of that microbiome health, that diversity here. And this group had lower levels of Clostridium and bacteroids, which is really beneficial for some of the changes that are occurring with pregnancy and maintaining a healthy pregnancy. And if you want to better understand the mechanisms and the root causes and some of the lab tests, I mentioned that we ran gut assessments within the advanced program, right? You can go into and log into your advanced and clinical functional medicine platform and start to learn about the lab testing. It's typically within the end of the presentations. Sometimes you'll start to see them within the middle of the presentation as well. We'll talk about some of the lab testing. And if you're a guest, make sure you check out our advanced and clinical program so you can get certified and offer functional medicine to your clients and your patients. Now, Dr. Asia, now that we've discussed the imbalances and the risks that are associated with it, let's talk about something positive. Let's talk about
Yes.
some of the benefits here, right?
Yes.
Let's not go into all doom and gloom.
Yes, I love it. Yes, more positive, and I think it's always good to kind of give some solutions to these types of things, even if they're not necessarily tried and true per se. I feel like probiotics and gut health is a really benign area to target with most patients that we see, including pregnancy.
Right. And now with even like the bacterioid species, right? The short chain fatty
Yeah,
acids,
exactly.
it's really targeting what
That's
the
right.
microbiome for these patients, because we saw that you mentioned earlier, right? The natural imbalances that can occur, but what are some of the changes that can occur in pregnancy, but what can happen with the imbalances that can throw this off
That's
a
right.
little bit, right?
That's
So
right.
now we can kind of target it a little bit more for our
Yeah,
patients.
of course, of course. So when you look at the world of probiotics and gut support, it's never ending, right? When you consider the use of microbiome therapeutics, I always recommend using products that are going to increase short chain fatty acids, so certain microbes that you're selecting for, that might be a consideration. There are also just specific products you can use that we'll talk about, microbiome products formulated for pregnancy and things of that nature. So studies have shown that the benefit of beneficial microbes, there is a benefit to adding beneficial microbes during pregnancy for pregnancy-related metabolic disorders. So a 2017 publication from the American Journal of Maternal Child Nursing summarized some trials looking at probiotic strains for maternal health. So they found a few things: supplementation with specific strains of probiotics such as Lactobacillus rhamnosus, GG, Lactobacillus acidophilus, combined with dietary counseling, have been found to improve glucose metabolism in healthy pregnant and lactating women. Daily intake of milk-based dietary probiotics, so think about like yogurts or even like kefir type products, have been shown to reduce blood pressure in pregnancy, as well as the incidence of preeclampsia among primiparous women. And then they also found daily yogurt consumption containing Lactobacillus rhamnosus was found to have a statistically significant protective effect against heavy metal toxicity, which we didn't really talk about, but is a big topic in pregnancy, in pregnant women with high risk diets, right? So we're going to take a look at one more illustration in this kind of line of the microbiome and preeclampsia. This is an illustration from the journal Frontiers in Cellular and Infectious Microbiology 2024. We see this possible role for probiotics in preeclampsia specifically. So this is not really related to gestational diabetes or preterm labor, but just more so preeclampsia. If you look at the clinical studies, adding probiotics in, we know just from previous podcasts, if you've been following along or if you're have a membership, the probiotics increase the barrier function, improve the intestinal hyperpermeability picture, lead to immunomodulation, produce short chain fatty acids, reduce your gut dysbiosis. But when you look at preeclampsia specifically in the clinical studies, probiotics have been shown to reduce hypertension, reduce systemic inflammation, and reduce the risk of developing preeclampsia. And it just kind of provides a protection against preeclampsia. So this is kind of the role of probiotics for supporting our pregnant patients with metabolic related issues. And like I mentioned, probiotics are relatively considered safe in pregnancy for the most part. And you do have brands that actually create more pregnancy forward probiotics with specific strains to target these types of things. So I'll pass it back to you, Dr. Chill, to kind of talk about that. But I think I just love the fact that we're able to use probiotics, something so benign. And you don't have to even use like capsule products, right? You can always just use dietary products and kind of fortify the gut with even fibrous foods to support better microbial growth. So I think it's a wonderful, fascinating area.
You're absolutely right. I mean, and if you do want to do supplementation, right, now we know the specific strains
That's
that you
right.
should be doing for this, right? So thank you for sharing that evidence with these specific strains, right? That's
Yeah,
Lactobacillus rhamnosus,
that's right.
Lactobacillus acidophilus.
Yeah.
And then we're also seeing the Lactobacillus rhamnosus in dietary yogurt as well. So typically what we do in the functional medicine approach is have some supplementation while looking at dietary approaches that you discuss, some of the fibrous foods that you talk about. And a lot of times those fibrous foods, what does it increase for our patients? Short chain fatty acids, right? That we talked about before. And so you can really look at this as a multi-pronged approach when you're working with your patients, from the foods to the supplementation to the lifestyle modifications. And with that, what supplements can you take? And not all probiotics are identical, right? Especially in reproductive health. As you were mentioning, Dr. Asia, there are specific strains that you really want to look for. And what we have seen, there is a specific probiotic that has these strains for helping with the balancing, right? And it's called it's from Microbiome Labs, and it's called Pregnancy Support. This is, again, considered safe during pregnancy. It's going to help with producing strains and supporting the current strains of the microbiome, that some of the strains that we talked about. This is both during pregnancy and after. That's the important part here, is the during pregnancy and after. We now know that in pregnancy, with some women who have the lower diversity and who have the imbalances, they can stay in balance for up to 16 months post-pregnancy, right? So we want to ensure that these formulations not only provide a healthy microbiome, but it can help to generate those short-chain fatty acids for them, leading to healthier microbiome. And this is a formula by Microbiome Labs. It's meant to support the vaginal microbiome as well as the digestive microbiome health. And this can also support the infant microbiome through breast milk. And there are other formulations that you can choose from. So it's always a good idea to support improved microbiome health through diet, including foods such as yogurt that we talked about, and safe probiotic enhanced and other safe probiotic enhanced formulas, such as adding things in like the short chain fatty acids, or there's even supplements that can help with improving short chain fatty acids as well. Now, if you're interested in learning more about the gut microbiome in pregnancy, make sure you log into your dashboard and go into the women's health section and reproductive health, as well as immunology. And this is going to be in the Advanced and Clinical Functional Medicine Certification Program. So make sure you revisit those modules. You can also, as Dr. Asia was mentioning, if you haven't already, make sure you book a coaching call with one of us if you have any case studies that you want us to help you with, so you can really offer functional medicine right away with your patients. I have practitioners that are bringing in multiple case studies for me and we're reviewing them on a regular basis. So it's whatever you need. Our goal is to really have you feel as comfortable as possible with the functional medicine approaches, so you can bring this to your patients right away. And this is a part of the program, and it doesn't cost anything for you. So, Dr. Asia,
yes,
this was some great information here on the microbiome, the risks, the changes that can occur during pregnancy, and then really how to kind of help with those changes.
Yeah, I definitely see a part 2 coming, just because the research is still so new. It'd be so fascinating to see what other microbes we learn about and how they impact the body through that leaky gut mechanism. So yeah, this has really, really been a wonderful conversation with you.
Yeah, absolutely. And it was so nice to do this podcast with you.
Yeah.
And also you said there's a part 2. We could probably even talk about some of those environmental toxins.
Yeah, that would be good. Yeah.
Right. That we just slightly touched on here. So again, thank you, Dr. Asia, for being here, Jacob and the film crew for being here as well. And then for all of you practitioners that are here, we couldn't do this without you. Hopefully this information was really helpful, especially if you're in fertility health or reproductive health. This is something that you can start to bring back to your patients right away. And we are glad that you're here. We hope you have a great rest of your day, your evening, whatever time it is where you're at. And we will see you in the next podcast. Thank you so much for being here.
Thanks, everyone.